CSF, biochemical part of the CSF. Since as I learned that the brain or central nervous system has not been covered, particularly cranium, so I thought it will be better if we start from the anatomy. So I'll spend a little bit of time on anatomy and then just briefly function that physiology part before I come to biochemistry. Otherwise, I could have come directly to the biochemistry and I could have spent good amount of time on biochemistry itself. The basic purpose of today's class is to diagnose 3 types of meningitis. One is bacterial, one is viral, and third one is tubercular. There are many diseases of brain and spinal cord. These can be diagnosed by other modalities. Like nowadays, it is basically CT scan, MRI is there. But without biochemistry and microbiology, this pathology, you will not be able to diagnose properly meningitis. So my emphasis on today's class will be basically just by looking at the report of biochemistry, you will be able to diagnose whether the patient is suffering from viral meningitis or bacterial meningitis or tubercular meningitis. Because this is very important from management point of view. All the 3 diseases need to be managed by 3 different mechanisms. There are 3 different protocols for treatment. So if you cannot diagnose, obviously you will not be able to treat the patient properly. The basic thrust in diagnosis, and at the end of the class, you will understand that even without seeing the patient, diagnosis can be made. Just like LFT, just like thyroid function test, what I taught earlier. এই দেখতে পাচ্ছি জিনিসটা, এই যে উপরে রয়েছে এগুলো দেখো এরকম লাগে স্ট্রাকচার, এগুলো জাইরাস, ঠিক আছে, এই দেখো একরকম। এই দেখো ব্রেনের পার্টটা এখানে কভারিং রয়েছে, এই কভারিংটা এখানে নেই, বা ওই যে ছিঁড়ে ছিঁড়ে গেছে। ব্রেন ইজ, এই দেখো, ব্রেন ইজ হাউসড উইদিন দ্য ক্রেনিয়াম। পেন্সিল বক্স দেখেছো তোমরা সবাই, পেন্সিল বক্সের নর্মাল বক্স, সেটা তুমি পেন্সিলে রেখে দাও, এরকম নাড়া ছাড়া কিছুই হবে না পেন্সিলটা। কিন্তু একটা সোনার গয়না বা কোনো একটা অর্নামেন্ট জুয়েলারি যদি রাখো, সেটাকে ওই পেন্সিলের বক্সটাতে রাখা যাবে? আর কি হয় বলো তো, ওর মাঝে মাঝে যে ইন্ট্রিকেট কাজগুলো সেগুলো নষ্ট হয়ে যায়, সেগুলো তাকে একটা কুশনিং হিসেবে ধরে রাখা হয়। তো এটা ভালো প্যাড তৈরি দিয়ে দেওয়া হয় ভালো রকম, যাতে চারদিকে ওই গয়নাটা খুব ভালো ওয়েল মেনটেন থাকে। আপনি যে ব্রেনটা, ইফ ইউ উড হ্যাভ পুট দ্য ব্রেন ইনসাইড দিস থিং জাস্ট, এইটার মধ্যে ধাক্কা খেলে পেন্সিল বক্সের মতো, it is much more valuable than any ornament, because original brain is just like some kind of দহি, মানে দই আর কি, বেসিক্যালি ঘন দই তৈরি করো, সেটা যেমন কনসিস্টেন্সি থাকবে খাইটা সেরকম। ছাগল বা গরু যারা কাটে, একটা ব্রেন নিয়ে দেখবে, হাতে নিয়ে দেখবে, জাস্ট লাইক একটা ফেস কেটেছে, একটা ব্রেন নিয়ে দেখবে, তাহলে বুঝতে পারবে। ইটস এ ভেরি ডেলিকেট স্ট্রাকচার। সো ব্রেন ইজ essentially covered by 3 things. One is Dura matter, and Dura is the, ঠিক আছে, এই কথা বলো রাখো, শুনে না যেগুলো বলছি শোনো বসে বসে। So Dura is the thickest part. It is something like this. So you have dissected this fasciculata. You have seen the fasciculata graph. The similar structure is the Dura matter. So if you require the Dura to be replaced, a graft needs to be made. The fasciculata is the most ideal graft to replace Dura matter. Dura matter is like this. So এই যে সালসাইজ এরিয়া রয়েছে, দেখো এই ব্রেনের পার্টটা এখানে কভারটা করে এবং রাখো কেন, ওখানে রাখো, ওখানে রাখো। So this is the basically gyri. Dura matter remains like this. Dura means durable, means it is tough. So that membrane remains overlying just like this. Dura matter. Okay. Underneath that, there is arachnoid matter. Arachnoid means coverable like. So this structure again will be remaining like this. But pia matter remains fully covered. Pia is a vascular layer, something like this. Do you get it? So on top of which This parameter is intimately, matter means mother, মানে সফট, খুবই সফট স্ট্রাকচার, তার উপরে একটা arachnoid matter রইল, জাস্ট লাইক কর্ব লেগ এরকম খানিকটা থাকে, তার উপরে ডুরা ম্যাটার। এই ডুরা ম্যাটারের একটা পার্ট ব্রেনকে কভার করছে, আর একটা পার্ট ঠিক উল্টিয়ে যাচ্ছে গিয়ে এই যে ব্রেনের স্কালটার ভেতরে একটা লেয়ার তৈরি করছে, দ্যাট ইজ এন্ডোস্টিয়াল লেয়ার। এই স্পেসটা, দি স্পেস বিটুইন দ্য ক্রেনিয়াম and the dura is extradural space. The space between the dura matter and the subarachnoid matter is the subdural space. The space between the subarachnoid and the pia is subarachnoid space. And it is in the subarachnoid space CSF moves. CSF remains both in the brain and in the spinal cord. তাহলে এইখানে দেখো কভারিং রয়ে গেল, এখানে একটা ফ্লুইড রয়ে গেল। এইবার যদি ব্রেনটাকে আমরা দেখেছি তোমরা ফুটবল খেলার সময় হেড দিয়ে বলটাকে সরায়, কিন্তু ইঞ্জুরি হয় না, কারণ এখানে যে মুহূর্তে এখানে হেডটা দিল সঙ্গে সঙ্গে ব্রেনটা মুভ করবে উল্টো সাইডে, কিন্তু এখানে ফ্লুইড দিয়ে বাফারিং করা আছে। এই দেখো ফ্লুইড, এখানে ফ্লুইড আছে, সঙ্গে সঙ্গে ফ্লুইডটা মুভ করলো ওখানে, ব্রেনটাকে কিছুতেই হিট করতে দেবে না ভেতরে। কিন্তু সব জিনিসের লিমিট আছে, খুব বেশি ঘটনা ঘটিয়ে দেয়। এখানে যদি খুব জোর হিটিং করো, হিটিং করে এমন একটা ইম্প্যাক্ট হয়েছে যেটা ডুরাটাকে একদম জলটাকে ডিসপ্লেস করে দিয়ে তখনই ব্রেনটাকে হিট করবো আদার সাইডে, রড দিয়ে হিট করা হয়েছে। এটা ফরেন্সিকে ভালো করে পড়বে, কাউন্টার খুব ইঞ্জুরি ফিঞ্জুরি সবগুলো বলবে তখন। বেসিক্যালি ইট ইজ প্লেইং এ ভেরি প্রোটেক্টিভ রোল, জাস্ট লাইক দ্যাট cushioning effect of that ornament box. So brain needs to be protected. Why I have brought? Because without this thing you will not know. So inside this thing there is covering of the cerebrospinal fluid. Inside this brain, that put it here. So inside the brain there are two ventricles also in this part, and there is one ventricle here, one there is third ventricle, one ventricle is here in the fourth, because there are open spaces. In addition, there are also cisterns. So these are the opening spaces through which the CSF remains. So it gives basically a good kind of buffering so that to prevent the brain from being injured, and it is giving some kind of buoyancy. So brain floats also, brain sorts nutrition. So otherwise, if you would have put it in the cranium, then you just remember that you are keeping a pencil in the pencil box without having any cushioning effect. Now, after this thing, the brain, this is foramen magnum, through which the spinal cord is coming. And this is, I have brought the lumbar vertebra. So in the neck, we are having cervical vertebra. So that spinal cord is coming through this, and it is passing through this like this through the spinal canal. This continuous. So this is the structure, and spinal, this CSF remains both in the brain as well as in the spinal cord in the subarachnoid space. How it remains, that I will discuss. Do you get my point? So just go there. So you structure, if you remove this structure, that means the brain will be exposed. The fasciculata grafting you must know during surgery, because one of the general practitioners working in a remote place of Nepal, he got a head injury with the skull removed and the dura matter removed. He made a fasciculata graft in the village itself and put a covering on the brain. But therefore, you must have that much expertise. How to make a graft? It can happen with anybody, and you will get a golden opportunity to practice and show your expertise. The child was saved. That is a good accident. Okay, just pause for. Go, and for the goat or for the cow, the cattle, you will try to get one brain specimen. They will give it. You purchase it. Feel the consistency. There is nothing, no wastage. That much money you can spend. You will see how the brain feels like. It is just like a little bit something more than a thick card. So it's a very delicate item. So normally brain is housed within the cranium. As I was explaining with a very good example, a pencil box you have seen the pencil box, be it plastic, be it metal. If you put the pencil and even if you move like this, pencil is not going to get damaged. At the base, its tips might get damaged. But in the ornament, jewelry, you cannot keep it in that box and I can move like this. It will be damaged because they are fine, delicate structures. So they are housed in a ornament box and there are cushioning effect is there. So this cushioning effect is made here by the coverings of the brain as well as the spinal, this cerebrospinal fluid. Why I have brought it to her because to give you an idea. So brain is like this. So if you make a whole করতে তুমি তোলো একজন তোলো এই ছেলের একটা তোলো তোরা তুমি শুধু দেখবে হ্যাঁ এই দিকটা এসে দেখো তোলো এইটার উপর রাখো আস্তে আস্তে রাখো সাবধানে রাখো এইটা ভালো করে তাকাও এইটার দিকে তাকাও এটা কভারিংটা রয়েছে এখানে কভারিংটা কিন্তু নেই ঠিক আছে একটু হোল্ড করো একদম ধরে থাকো একদম ধরে থাকো ধরে পড়ে গেলে আমি বিপদে পড়ে যাবো মানে স্পেসিফিক নেই so it is just like this finger this part okay বুঝতে পারা গেল এখানটা তুমি দেখতে পাচ্ছ না বলে নাও দেখে নাও এই দেখো তাকাও এরকম স্ট্রাকচারটা রয়েছে তুমি দেখো ওইদিকে ঘোরাও ওইদিকটা ঘোরাও হ্যাঁ এটা জাস্ট অর্ধেকটা এই যে এই মাঝখানটা দিয়ে কেটেছে আমি গোটা মেনিঞ্জাসটা এখন করে দিতে পারতাম না এরকমটা কিন্তু এই পড়াতে গেলে তোমাদের সময় লেগে যাবে না খালি হয়ে যাবে ব্যস্ত জল জায়গা শুনি এবার নামি দাও দেখে জিনিসটা এবার দেখা দাও এবার ডুরা ম্যাটারটা কি হচ্ছে ডুরা ম্যাটার ইজ দ্য থিকেস্ট ডুরা মিন্স ডিউরেবল অ্যান্ড থিক so basically it remains just like this covering like this it is the thickest part and then underneath this thing one part is covering the brain and the other part is reflecting onto the under surface of this cranium so this is like just like this okay but it is covering the gyrus similarly this underneath that thing that is arachnoid means cobweb like just for simplification I have brought it so arachnoid space also arachnoid membrane also remains like this in contrast pia means soft matter means mother so pia matter remains like this somewhat it is intimately connected with the brain tissue and then on top of which there is subarachnoid matter and on top of which dura matter. So the space between this brain and the dura matter is called extradural space. And if there is a heating and if there is a blood here, it is not going to cause much damage. It is very easy to puncture here. I locate in the CT scan, puncture it and drain this blood and the patient will get immediately recovery. That's the charm of extradural hemorrhage. And by chance if it is in subdural it will not be that easy. So this space above the dura is extradural, this space below the dura is subdural and this space below the arachnoid is subarachnoid space and CSF remains in the subarachnoid space and it is in continuity with the spinal cord also. So you see there are three membranes, one is intimately attached to it and one is above this gyrus and the third one is on top of which and CSF is like this. So CSF basically there is a fluid covering, so it is protecting the brain. It is acting as a shock absorber. For example, I was giving a patient, football player head diচ্ছে মাথা নাড়াচ্ছে এদিক দিয়ে but brain is moving, brain is also moving. But it is not getting hit on the other side of the membrane because there is fluid buffering, shock absorb for this. There is a limit for everything. If you move it too much beyond the capacity, then there will be head injury on the other side. Similarly, if you hit it, and if the heat is severe, if it suppose breaks the skull, then that particular protection will not be there, brain will be directly hit in this side also, that side also. Particularly here, directly injury হবে এখানে ওই জায়গাতে একটা আলাদা ইনজুরি হয়ে যাবে হিটিং ইফেক্ট বুঝতে পারছেন ব্যাপারটা so it is giving an heating effect and after the brain has been this brain part is done now in the this is lumbar vertebra I will show you why I have brought it so in the neck we are having cervical vertebra So this cervical vertebra is placed like this. This you can palpate. In your body, it can be easily palpated because it is a thin layer. You see the spine, there are projections like this. So these basically spinal cord is coming through the spinal canal and it is housing the spinal cord. Okay. Now I will show the importance of the vertebra once you go to, now go back to the class. Try to memorize as much as you can. All these things what I will tell you today will not be required at the first year level, but it will be required in your clinical years, and whatever I am teaching beyond this, you will not be required anything in medical practice. So therefore, today you make the note and keep the notes with you, and in future you consult this particular note during your 4th or 5th year class, and when particularly you will be seeing a meningitis patient, you come back to this class note, you will be able to diagnose properly without help of anybody. So analysis of biochemical parameters and this basically interpretation part is very important. That I have framed a question and you will be able to answer, you will be asked to answer to those questions. But before that I am going to show you something. So the original things which will be the actual summary of what will be requiring about CSF. So where CSF is present? I have told you it is present in the subarachnoid space and in the ventricular system. There are ventricles. So it is present in the subarachnoid space, that is between the adrenal matter and the pyometer, I have explained, right down, and the ventricular system around and inside the brain and the spinal cord. CSF production, see, where the body fluids are basically produced from plasma, and the main mechanism is ultrafiltration, be it urine formation, be it ascitic, be it pleural, be it pericardial, be it CSF. So the basic mechanism is ultrafiltration. So ultrafiltration means the protein content will be too low. There might be some other diffusible substances will be present, but protein concentration will be remarkably low in all the body fluids. And as you know, in the urine, we get total protein concentration of 24 hours about 50 to 150 milligram per 24 hours. So similarly, so CSF is produced from a core plexus. In the globulus, you have seen there is a tuft of capillaries. The same type of capillaries is there, plexus is there, that is called core plexus, not globulus. So it is present in the lateral ventricle, it is present in the 3rd ventricle and 4th ventricle. I will show you the next slide where it is located. It is produced in ultrafiltrate and per day production rate is about 750 ml. But at a given point of time, the total volume is 150 ml. So that means there must be an absorption system. Otherwise, how it will house 750 ml. See, we are drinking water, we are passing urine. Bladder is getting full, empty, again bladder is filling up. So there is a continuous production of urine formation, just like that, continuous production of CSF formation. And it is also getting reabsorbed. How it is getting reabsorbed, that I will show in a short while. So secretion rate, must be it is by around less than 0.5 ml per minute. And the volume is 125 ml on an average in 70 kg person, but you know there is a quite variation in the patient body weight, size, shape. So accordingly, there will be some variations. This cannot be absolutely fixed at 125 ml. Maybe 120 ml, maybe 130 ml, something like that. So 50% of the total volume is replaced in every 5 to 6 hours. That means 100% will be basically replaced in 12 hours. So there is a continuous production. Why there is a continuous production? Because brain requires nutrition and that nutrition has to be provided. But without that thing, from the blood glucose level will be basically delivered into the CSF. The CSF, how does it flow? As I was explaining, that it flows basically from the surface of the brain down the spinal cord in the subarachnoid space. And again in the schematic diagram I will show it to you. So this will cover basically all the anatomy, physiology and the biochemistry part also. I am forced to tell all these things because these were not covered in the physiology. This, if you cut the brain, what you have seen, you have seen the brain has been cut in this section, sagittal section. But if you cut it here, if you cut this side, so you will get a structure like this. This is coronal section. So there are two lateral ventricles. You see the tuft of capillaries here, that is choroid plexus. You see the third ventricle, there is also choroid plexus. The fourth ventricle, there is choroid plexus. So from these plexuses, this CSF is formed. So I could have covered this meninges part totally, but because of short of time, I could not do. Remember, on the top of which there is superior sagittal sinus. This is one important part through which the CSF is drained, just like urinary bladder. This formation here, drainage is there. So this is the ventricular system, means this type of ventricles are there inside this part, one on either side. And there is a connecting system. This is third ventricle, this is the fourth ventricle. These are all connected. How these are connected, you will see in the video itself. This you write down completely, particularly the verb. See, there are two lateral ventricles. There are two lateral ventricles on either side, on either cerebral hemisphere. And there is an interventricular foramen called foramina Monro. Write down. Foramina Monro. Through foramina Monro, the cerebrospinal fluid comes to the third ventricle. Basically, I am telling you how cerebrospinal fluid circulates. It is formation from lateral ventricle through interventricular foramen Monro to third ventricle, and from third ventricle through aqueduct of Sylvius. There is a duct, connecting duct. They call cerebral aqueduct, comes to fourth ventricle. In the fourth ventricle, there are three openings. One is foramina magendi. It is present in the middle part. And on either side, there is foramen of Lasca. M for magendi, median, L lateral for Lasca. Remember. Then from there, it is going to through the opening, it is going to the subarachnoid space and to the arachnoid villi, and then finally draining to superior sagittal sinus. I have shown it to you. This arachnoid villi basically in adult life progresses to arachnoid granulations. Now remember here, this important part. This is formed, as I told you, on two lateral ventricles, third ventricle, fourth ventricle. So it is, formation is there. Now drainage system is here. Through the foramina magendi, it is covering the spinal subarachnoid space. Remember. Note down, foramina magendi, median aperture, passing the foramen of magendi results in filling of the spinal subarachnoid space. এই পার্টটা ভেরি ইম্পর্টেন্ট পার্ট। ব্লক যদি এখানে হয়ে যায়, বাই চান্স টিউমার হয়ে যায়, ওই জায়গাটাতে সার্কুলেশন পাবে না, সিএসএফ আসতে পারবে না। Brain tumor occurs, so it will cause in the flow of CSF because these channels will be blocked anywhere depending on the location of the brain tumor. That is clinically very important. So foramina magendi, subarachnoid space, foramina Lasca in this present on either side. So it is covering the cerebral hemisphere, just like this. So CSF egressing through foramina Lasca travels into the subarachnoid space of the cisterns and subarachnoid space overlying the cortex, cerebral cortex. Both cerebral, দুদিক আছে, তো দুদিক দিয়ে যাচ্ছে। বোঝা গেল? তাহলে সাবারাইনাল স্পেসে মেজেন্ডি দিয়ে যাচ্ছে, লাস্কা দিয়ে দুটো সেরিব্রাল হেমিস্ফিয়ার উপরে গেল। So now this entire part is covered. So in the subarachnoid space, write down this thing, I will show you it in the video itself. from the subarachnoid space reabsorbed through outpouchings called superior of the into the superior sagittal sinus. It's a venous sinus. And arachnoid granulation is an avenue for CSF reabsorption. This arachnoid villi is having a valve-like mechanism because it allows the CSF to flow from subarachnoid space into the venous system and not from the venous system into the CSF. Otherwise, it will be mixed, blood will be mixed. So remember that AV valve doesn't allow this valve in the arachnoid villi doesn't allow the blood to flow back into the CSF, but it allows the CSF to be drained into the venous system because of the pressure gradient. And clinically relevant point is this one. Again, I will repeat this point. You note down here. In the subarachnoid space, CSF comes in contact with the perivascular spaces. This is most important clinically. In the subarachnoid space, CSF comes in contact with the perivascular spaces around the blood vessels. ছবি তুলতে বারণ করেছি, লেখো, বইয়ে সব আছে, বইয়ে সব পাবে। এখন বসে বসে যতটা পাওয়া লেখো, মুখস্থ করো না, মেমোরাইজ করো না। এটা আসবে পরীক্ষাতে না এলে কাজে লেগে যাবে। সব দিয়ে দেবো আমি, আমার সব লেকচার পুরোটাই দিয়ে দেবো, আমি নিয়ে বাড়ি যাবো না। এগুলো বুঝে না, বাকিটা বইয়ে লেখা আছে, সব পাবে। যেটা পাবে না সেটা আমি বলে দেবো লেখার জন্য। This area is important because leak occurs during the inflammation. This viral meningitis, bacterial meningitis, tubercular meningitis, what I am telling, during that there will be inflammation. Itis means inflammation. So because of that itis, there will be leaking from this area in the subarachnoid space, which is coming in contact with that. Rest of the part is not concerned. There will be inflammation, but actual pathology is here. Something like this medical college. It is located in this Muluk, in this part. It is located in Bolpur, but not in the whole Bolpur. Okay? এটা হয়েছে, তাড়াতাড়ি লেখো। এই দেখো, ভালো করে তাকায় দেখতে পাই। এই দেখো আউটপোচিং, যেটা arachnoid granulation বললাম, এইটা subarachnoid space সবুজ মতো। This arachnoid granulation, this is superior sagittal sinus. এইখানে এটা করছে। আউটপোচিং পেয়েছে, এইখানে দিয়ে ড্রেনিংটা হচ্ছে এই জায়গাতে। একটা ছোট্ট ভিডিও দেখাচ্ছি, তাহলে বুঝতে পারবে। কালকে হলো সেটা কেন আসছে না? বাবা, এই সফটওয়্যারটা কাজ করছে না। দেখো, তাকাতা, এই দাও, ভালো করে এই ছবিটা দেখো। ছবি এই দেখো, ল্যাটারাল ভেন্ট্রিকেল তৈরি হচ্ছে CSF-টা। এই দেখো আউটপুটিং দিয়ে চলে গেল সাইনাসে, থার্ড ভেন্ট্রিকেল একদম ফোর্থ ভেন্ট্রিকেলে চলে এলো। একদম ফোর্থ ভেন্ট্রিকেল থেকে এই সাইডে দিয়ে চলে যাচ্ছে সাবআরachnoid স্পেসে, এইটা চলে এলো ওই পার্লার সাবআরachnoid স্পেসে। ওই দেখো সাবআরachnoid গ্রানুলেশন, ওই সুপিরিয়র sagittal সাইনাস। বুঝা গেল? আর একবার দেখাচ্ছি, ভালো করে দেখেন না গোটা ব্যাপারটা। ওই লেখাটা যেটা রয়েছে পড়ে না, একবার লেখাটা মিলিয়ে না, একবার দেখে দিচ্ছি। ওই দেখো সাইনাস প্রথমে ফিল আপ হয়ে গেল, সারফেসটা কভার করতে কি হলো, ওই দেখো। ঠিক আছে, একবার দেখে নাও ভালো করে। আর তো দেখানো দেখা পড়বে, আর দেখবে একবার। ওইটা বেসিক্যালি সুপিরিয়র সেরিব্রাল সাইনাসটা, সুপিরিয়র সেরিব্রাল পড়বে তুমি ভালো করে। ওই যে গ্র্যানুলেশন সেইগুলো, গ্র্যানুলেশন সেইগুলো। কোনটা? এই যে এই সাইডটা, এটা ডুরা মেটারের পার্ট আছে বেসিক্যালি। এইটা বেসিক্যালি ইন্ডাস্ট্রিয়াল লেয়ারটা আছে, যে বললাম না দুটো লেয়ার আছে। এগুলো ভাবিলে বলবে জাস্ট একটা কনসেপ্ট দেওয়ার জন্য দিচ্ছি। এগুলো দেখতে জিজ্ঞেস করে পড়বে তোমাকে। ভালো করে জাস্ট দেখে নেবো ভালো করে। হ্যাঁ তুমি পারবে, ভিডিও নেটে গিয়ে দেখবে তাহলে হলো। আমি বসে বসে এগুলো সার্চ করে বার করলাম যে এইটা তোমাদের ভালো লাগবে, কম সময়ের মধ্যে দেখা যাবে বলে এটা নিলাম। নেটে প্রচুর আছে জিনিসপত্র, যেটা ইউজফুল সেটা পড়ো খালি। আর যেটুকু লিখে দিলাম ওই পার্টটাই মুখস্থ করো, ব্যাস ওটাই লাগবে পরীক্ষায়। তো ছবি দেখে তো তোমার পাগল হয়ে যাচ্ছে তাহলে। আর এই দেখো ব্রেনটা, এই দেখো এই দেখো ভালো করে শুনে ওই দিকটা দেখো, ব্রেনটা কভার করা আছে সিএসএফ দিয়ে। যে এমআরআই যদি করে এরকম আসবে, দেখছো যে ফ্লুইডটা দেখলে, ফ্লুইডটা দেখছো বলে এরকম ফ্লুইডটা, এই দেখো দেখো বুঝা গেল। এই ব্রেনটা দেখো সামনে রয়েছে, ওই দেখো ফ্লুইডটা। নর্মাল স্ট্রাকচার ফ্লুইড না থাকে তাহলে এই স্ট্রাকচারটা দেখতে পাওয়া যাবে না। হয়েছে, বুঝা গেল। এই পার্টটা যদি হয়ে যেত না আমার পড়াতে সুবিধা হতো। এই যে বললাম যে অলমোস্ট সিএসএফ, আর বাকিগুলোর নাম মনে রাখলে চলবে। You remember what is the actual volume of CSF? That is 125 to 150 ml of CSF is present in an adult, not in the child. And there are different spaces, that is cranial subarachnoid space is there. I've made a small breakup. Cranial subarachnoid space is 100 ml. Spinal দেখো almost 1/4 থাকে। 25 lateral ventricle দুটোতেই থাকলে দেখো ওই 25 to 30, মানে স্পাইনাল আর lateral ventricle একই ভলিউমে থাকে। থার্ড ভেন্ট্রিকলটা খুব ছোট, you will see in the anatomy and you will read in the anatomy, and also fourth ventricle খুবই ছোট, এগুলো 2 থেকে 3 এর মধ্যে থাকে। So ভলিউম দেখে বুঝতে পারছো what could be the actual size. So due to tumor, it is there very likely that area will be compressed, and that will impede the flow of the CSF, and there will be some symptoms, there will be some problems. So during operation, this clearing of this part is very important. Now, as I was telling that if you did not have that covering and the CSF, there would not have any buoyancy. So brain has to is acting like a floating. The CSF is allowing to brain like to float. So it is maintenance of buoyancy to ensure blood supply and protection from injury. I have explained it. So what is the function? This is the physiological part. So when jolted are healed by providing a buffer, fluid buffer, is a shock absorber. Bola? Prevention of brain ischemia. Some pressure is there, so it maintains the intracranial pressure. So it facilitates blood perfusion at homeostatic regulation. And there is no kidney, there is no lymphatic system, so removal of waste product is also an avenue. The CSF is an avenue for removal of waste product. So up to this part is anatomy and physiology. If this part would have been covered, then this much time would have been saved. So now, where from CSF, for blood investigation, you will be writing for blood investigation. Do you want time? You want time? note down, this will be required. What are the functions of CSF? At least you maintenance of buoyancy, protection from injury, prevention of brain ischemia, homeostatic regulation, removal of waste. That's. You have to memorize a lot, and you must answer very fast, so that examiner will understand that you read it. At least first 2 points you must tell. Second point is most important: prevention of injury, as acting as a sub-absorber. And I have been teaching you, and I cannot answer it, you my insult. You share insult on me. Okay, that's the composition of CSF. What is the difference between the plasma and CSF? See, write down one important part: lipid and bilirubin is conspicuously absent in CSF. থাকে না ইউরিনের মতো ইউরিনে বিলিরুবিন তা পাওয়া যায় এখানে বিলিরুবিনও পাওয়া যায় না ইউরিনে লিপিডও পাওয়া যায় না but ইউরিনে বিলিরুবিন পাওয়া যায় but here bilirubin is not present because you get some color in the urine but CSF is colorless because bilirubin is not present. Now just note down whatever has been written in the red because this will be important clinically. The glucose is present in the plasma and it is almost 50% is present in the CSF. It's a normal concentration. So uric acid level is also considerably low. Particularly protein part you write down. Protein part this is normal total plasma protein is 6 to 8 grams. 6 to 8 grams means 6,000 to 8,000 milligram per deciliter. I repeat, 6,000 to 7,000, and I have taken the middle figure as 7. That is 7,000 milligram. In contrast, if you look at this picture in 3 different parts, you remember this lumbar part. At least 15 to 45 milligram. 7,000 milligram and 15 to 45 milligram. So basically, serum protein, CSF protein ratio is 200:1. So in the plasma, it is present in about 200 times more than this. It is an ultrafiltrate. It is not allowing high molecular protein to pass through. That you must remember. Particularly try to remember glucose level. In an otherwise normal individual having a blood glucose of this much, plasma glucose. Now if somebody is diabetic, his blood glucose will be high, obviously CSF glucose will also be high and you must not misinterpret. So whenever you are doing a CSF analysis, you also collect a sample, a blood sample, because you don't know whether the patient is diabetic or not. And during IV fluid, never try to do an CSF because this is likely to get a false result and you will not be able to interpret and you cannot puncture twice. You cannot correct CSF twice only for your mistake. So this is the most important part again I am telling you. For interpreting glucose report, you must ensure that whether the patient is diabetic or not and whether the patient is hypoglycemic or not also. The blood glucose may be lower, here her blood glucose might be here, this level. So again 50% of that value will be there. So that is very important. Protein by and large remains concentration dimension until and unless you give a fluid. So in the indoor setup, IV fluids are given. So it will be diluted. Again there will be a problem. So albumin concentration again you see here it is 3.6 gram. It is in milligram. Something like that. 0.155 gram. That means you multiply it by 1,000. So that will be 15 gram only, 15 milligram. These are not so much of clinically important. Only thing I want to highlight that magnesium is present in higher concentration and also chloride is present in higher concentration in CSF than in plasma. All other parameters are in lower concentration. Sodium is almost equivalent, but all other parameters are in lower concentration in CSF. Most important part is glucose and protein, or albumin, you can say glucose, protein, albumin. So you must be able to remember these three value of these three parameters. From a biochemistry point of view, and remember CSF AG ratio is 3:1. That means albumin is higher than globulin. Globulin is a high molecular protein, so it will not come out, be present. Serum protein and CSF protein ratio is approximately 200 to 1. Why I am asking you to write? Because all these things will not be available in your book. These will be all available in the clinical books. Now, for blood testing, you advise, and the other day I was talking about who will collect the blood. You have advice for blood, sugar, urea, creatinine, glucose, cholesterol, triglycerides, you have written. Advice. Now, who will collect the blood? Huh? Doctor collects the blood. Normally? Bola. Normally nurse. Okay, nurse is putting the word. If the patient is admitted, definitely nurse will collect. And paramedical staff, yes. In the laboratory technician. But there will be cases where the nurse and the paramedical staff will tell that I cannot collect the blood. And at that time, who will collect the blood? Doctor. Therefore, your expertise must be at a significantly higher level than those who are doing it regularly. So, for that you have to practice. There is no other option. Wherever you will get an opportunity to stop the sister or paramedical staff not to draw the blood. Try to draw the blood yourself. And in each and every case, maybe you might be there with some learning points. And these learning points I expressed told in detail. And I have done also, while I was the director of the hospital also, I used to collect the blood because I did not want to lose my own expertise. Because I had to give injection, I have to give IV fluids in the rural setup. Or wherever I go, immediately I have to give an IV fluid. If I cannot give an IV fluid, and for that if I have to call the compounder or say a medical paramedical staff, you just puncture it, it will share insult on me. Particularly aged patient, particularly the children whose veins will not be that much prominent. But immediate urgent IV fluid is required. So you have a mastery. You practice. But blood can be collected from anywhere in the vein. But where from CSF is collected? Spinal cord is long. Spinal cord থেকে নেওয়া হয়। Vertebra থেকে নেওয়া হয়। Vertebra the heart. The heart. Lumbar region কেন? সে cervical region থেকে নেওয়া যাবে না? নেই। মাথা থেকে নেওয়া যাবে না? এখানে ফুটো করা যাবে না এই জায়গাটাতে? এখানে ফুটো করা যাবে। এখানে টানা যাবে। এখানে রিপেয়ার করতে টাইম লাগবে, তাহলে নিচে রিপেয়ার করতে টাইম লাগবে না? তো এখানে তো ঘাড় এখান থেকে নেওয়া যাবে, ঘাড় এখান থেকে নেওয়া, এখান থেকে নেওয়া, সেটা সব গোটানি সিট দ্বারা কোথেকে পাবে? CSF কোথেকে কালেকশন করা হয়? কোথা থেকে কালেকশন করা হয়, কিভাবে কালেকশন করবে, আর কে কালেকশন করবে? These are three important issues because these you have want the CSF to be examined. Now try to understand. This is the SGD group, so I want an interaction also. ঘাট থেকে নেওয়া যাবে? নেওয়া যাবে? যাবে না। কেন? তুমি না বললাম। ঠিক আছে, না মানলাম তোমার কথা সত্যি। কেন? সেন্সিটিভ এরিয়া। আচ্ছা ঠিক আছে, ওটা দিয়ে নেবে না। ব্রেনের সাথে অসুবিধা হচ্ছে। ঘাড়ে দিলে কি হবে? এই ঘাটটা যদি ইঞ্জুরি হয় কোনো কারণে, এই জায়গাটা যদি ইঞ্জুরি হয়, কি খাওয়া বলো দেখি? ঘাটের পুরো ঘাটটা থেকে স্পাইনাল কর্ডটা মনে করে ইঞ্জুরি হয়েছে, খুব জোর হিট হয়ে গেছে, স্পাইনাল কর্ডটা ড্যামেজ হয়ে গেছে, কি হবে? হ্যাঁ, প্যারালিসিস। কোনটা যাবে? হ্যাঁ, ও ঠিক বলে যাবে, প্যারালিসিস হবে। কোনটা প্যারালিসিস, পাটা না হাতটা? হাত, পাটা হবে না, হবে না, হাত পা দুটোই যাবে, চারটে আর অর্গানিক ইমোবিলাইজেশন, ব্যাস পুরো কোয়াড্রিপ্লেজিয়া। লোয়ারে হলে পাটা যাবে, আপার হলে আপারটা যাবে, লোয়ারটা যাবে, ব্যাস আউট। সেই জন্য হেড মুভ যখন করবে, যেখানে খুব ভেরি প্রোটেক্টিভ, দিস পার্ট ইফ ইট গেটস ইনজিওর্ড দেন গান। হ্যাঙ্গিং এর সময় যেটা করা হয় সেটা বেসিক্যালি একটা উডন্ডার প্রসেস আছে, টুক করে এদিকে টাচ করে দেওয়া হয়, স্পাইনাল কর্ড থেকে ব্রেনটাকে ডিটাচ করে দেয়, ইমিডিয়েট ডেথ হয়ে যায়। এটা পরে বলে দেবে, ফরেন্সিক জিনিসপত্র জানিয়ে বলে যাও। আচ্ছা বলো, সার্ভাইকাল নেওয়া যাবে, থোরাসিক এখান থেকে নেওয়া যায়, পিঠ থেকে নেওয়া যাবে তো? হ্যাঁ, লাম্বার, লাম্বার দেখো, লাম্বার লাম্বার কেন কেন যাবে না, লাম্বার বলেছে। আচ্ছা ঠিক আছে, লাম্বারটা ঠিক আছে, লাম্বার বলে, লাম্বার থেকে নিশ্চয়ই নেওয়া যাবে। তো লাম্বার কোন জায়গা থেকে নেবো? লাম্বার কটা ভাটি করে আছে? 5টা। তো কোন জায়গা থেকে নেবো? 4 থেকে পরে এখানে কোথায় হিট করবে? এটা 4 কোন জায়গাতে হিট করবে, কোনখান থেকে নেবে? হ্যাঁ, পড়ার ফিফথের মাঝখানে, ঠিক পড়ার ফিফথের মাঝখানে। ও বলেছে অ্যাটলিস্ট কম সময় একটা উত্তর দিয়েছে, পড়ার ফিফথের। দিয়ে এগ্রি? পড়ার ফিফথের মাঝখানে নিলে কি অসুবিধা হবে দেখো, 1 আর 2 এর মাঝে নিলে কি অসুবিধা হবে দেখো, 3 আর 4 এর মাঝে নিলে কি সুবিধা অসুবিধা হবে সেটাও দেখো, একটু পরে দেখে নাও। আচ্ছা, হাউ টু কালেক্ট CSF? রিমেম্বার, it's not a child play, it's just like blood, it is just like OT. Complete aseptic procedure must be maintained, because the patient may not have a CNS infection, and if you insert a needle into the CSF not properly sterilized, you are likely to introduce infection into the central nervous system. So there will be meningitis, and this is called, if it is not done properly, it's called arachnoid meningitis. The patient did not have meningitis, but you have induced meningitis, and that you must never do. So try to take all precautions, aseptic precautions, just like OT, and you will be taught how to sterilize this area. That I can discuss, but it is beyond the scope. I can tell you also at the end of the class if time permits. Now, who will correct the CSF? Why? Huh? You? বাচ্চা বা ছেলে খেলা না, ঠিক, ছেলে বাচ্চা খেলা না, ঠিক, ছেলে খেলা না, রাইট, it's not a child's play. So technician will not have that much knowledge and idea. Even doctors at times fails, but I'll try to explain so that you, in your first attempt, must succeed in collecting a CSF. So basically, CSF is collected from the lumbar region. It is collected using an aseptic procedure, totally just like an OT operation procedure, and a medical graduate, at least with the qualification of MBBS, must draw CSF. No other person will be allowed to have a CSF. So you have to have a mastery of collecting the CSF. You must not puncture twice. So as I told you, it is an aseptic precaution. Well, lumbar puncture needle is something like this, a little bit slightly lesser caliber than a cycle spoke is. See, if you insert between L5 and L4, see, if you push it L1 and L2, spinal cord ends at the lower border of the L1 vertebra. So there is a high chance that you are likely to injure spinal cord by introducing needle this path. Do you understand why this L1 and L2 is not selected? L2, L3, again in some cases it might come down a little bit. So there is a chance. So it is done basically between L3 and L4 vertebra in that space. And if you go beyond down, then the conus beribularis. You will see in the spinal cord anatomy and the spinal subarachnoid in detail. If you cannot understand, then I will again explain. So you are leaving a margin between the two. So the ideal procedure is between the L3 and L4 vertebrae. Now, how will you determine L3 and L4 vertebrae? How? How will you determine the L3 and L4 vertebrae? দেখা এখানে ভালো করে বুঝিয়ে দিতে এদিকে এসে খাতাটা রাখো, এটা ঘাটটা এখানে বেন্ড করো, এখানে দেখাও, তাকাও, এইখানে যদি তাকাও, এখানে দেখো, এইখানে যেটা টিপ প্রথমে পাবে না সেটা C7, এখান থেকে কাউন্ট করা অনেক ডিফিকাল্ট, কাউন্ট করলে মিস্টেক করে ফেলবে, খুঁজে পারবে না করতে, মিস্টেক হবে। তার চেয়ে এখানে তাকাও, এখানে হাত দেখা, সবাই কোমরে হাতটা রাখো, এটা হাইস্ট পয়েন্টে রাখা একটা টপ পয়েন্টে বলি পয়েন্ট পাবেই পাবে, টপে দেখতে পাচ্ছ, এইটা হচ্ছে হাইস্ট পয়েন্ট অফ দ্য ইলিয়াক ক্রেস্ট। এই জায়গা টাকা এখানে, এই জায়গা এই পেশেন্টটাকে এরকম করে বেন্ড করানো হয়, নর্মালি এরকম থাকে, পেশেন্টটাকে এরকম করে বেন্ড করানো হয়, কনভেক্স করে না। কেন কনভেক্স করা হয়? তাহলে নর্মালি আমাদের স্পাইনাল কর্ডটা এরকম থাকে, এই দেখো ভালো করে, এই দেখো একদম পুরো ফিক্সড হয়ে আমি স্ট্রেট দাঁড়িয়ে থাকছি, এখানে লিগামেন্ট ফিগামেন্ট থাকে, আমরা স্পাইনটি যে বেন্ড করতে পারছি, এটা এরকম করে একটা মুভ করছে, স্টাইলি মুভ করছে। যখনই আমি এটাকে কনভেক্স করবো বেসিক্যালি স্পাইনাল কর্ডটাকে, তখন এই স্পেসটা বাড়ছে, এই দেখো ভালো করে তাকাও, ভালো করে এই জায়গাটা, এই দেখো ওপেনিংটা, তোমাদের কিন্তু এটা ভালো করে শিখিয়ে দিচ্ছি। এই দেখো এই স্পেসটার মধ্যে দিয়ে স্পাইনাল কর্ডটা এখানে, এই দেখো এটা ভালো করে তাকাও, এইটা হচ্ছে স্পাইনাল ক্যানালটা, এটা ইন্টারভার্টিব্রাল ফোরামেন, এটা এইটার ভেতর দিয়ে ঢোকাতে হবে নিডলটাকে, দিয়ে তবে এই জিনিসটা এইখানে আসবে। ভালো করে দেখো, এইটা ভার্টিব্রাল স্পাইনাল কলামটা, এইটা ইন্টারভার্টিব্রাল স্পেসটা তোমাকে ঢুকতে হবে, ঢুকবে এই ফোরামেনটা দিয়ে, ঠিক আছে? দিস ইজ বিটুইন L3 and L4 ভার্টিব্রা। এইবার যদি এটাকে বেন্ড করাও এইভাবে, এটা ডিফিকাল্ট, বিকজ why difficult? Because in the when there is a meningitis, there will be stiffness of the spine because all the nerves are inflamed. In the old age also it is difficult, or in some patients spine becomes convex basically. So anyway, you try, ask the patient to put the head towards knee, flex the knee, and ask the patient to make an arch like this, so that this area becomes a little bit widened. This structure is like this, so there will be some widening over there, and at least 1 centimeter widening will help you, or more than 1 centimeter will help you to insert the needle with a larger opening than if it is kept like this. And that is the reason why convex is there. Now, at the highest point of the iliac crest is here. When you go back to the hostel, you just scroll down to below, you will see the anterior superior iliac spine. And highest point of the iliac crest is here. Now draw a perpendicular line through the highest point of the iliac crest, and it will be exactly in this space, L3 and L4 vertebra. Now by doing this thing, you just determine this part. I need to look at it very carefully and ask the patient to bend. Put your hand like this and ask the patient to bend. So you identify the spot, and then after this aseptic preparation, you put the needle here, skin will be, resistance will be there, and then it will go inside it, and there will be intervertebral space also, there will be another resistance. And suddenly the needle will give way, and the moment the needle gives way, that means you are in the subarachnoid space. Don't go beyond that, because it will touch the other side of the patient. And the moment you go into the subarachnoid space, the fluid will start coming from the other side of the needle, this side of the needle, just like blood. If it cannot come, then you are not in the space. Either you have hit bony part here, and blindly will go on doing this thing. So do you understand? You need to observe from somebody very carefully, and then grab the earliest opportunity to do yourself under his guidance. At least 2 to 3 times you must do under some senior guidance, and do it very confidently. Put the knee right. I think you will be able to do it. Before that, you read it thoroughly. Today, videos are available. So don't lose any opportunity. And you practice it as many times as possible. All the patients you will not be succeeding. We used to get work in the encephalitis ward. I have punctured at least nearly 40 LP I have made. LPs I have made. So I know this technique and I can collect it. So do you get my point? So collection of CSF. Is this part clear? So this is the reason I have brought this vertebra. So this vertebra will be taught in detail. So the indications for lumbar puncture is this one, meningitis. Meningitis means inflammation of the meninges. And encephalitis means inflammation of the brain. So when the meninges is in continuity with the brain, so there will be some amount of encephalitis. So, or if there is pure encephalitis, there will be some amount of meningitis also present. So it can be meningoencephalitis. But predominant part will be one. That is whether it is meningitis or whether it is encephalitis. And you need to differentiate between among the three. These three is the basic thrust area. Subarachnoid hemorrhage. During our MBBS time, we did not have CT scan facility. We have to diagnose this LP, and I have diagnosed one case of subarachnoid hemorrhage clinically, and I did an LP and showed it to my boss that this is the finding of LP, and boss also accepted it. How does it look like? You must see. Brain tumors. Of course, during our time again, due to that thing, could not be diagnosed. Other CNS infections like Neuroanatomy syndrome. This again needs to be diagnosed by biochemistry investigation, not by others. Demyelinating diseases, subarachnoid hemorrhage, brain tumors can be diagnosed by CT scan or MRI. So for that you need not require to do an LP. So in your examination, a case might be given as a spot or a question also. If child or adult, aged, this was female, this 30 years female presented with fever, headache, neck pain, or alteration of sensorium, means some sort of, sensorium alteration is there, drowsiness, semi-consciousness, unconsciousness, and with neck rigidity, has presented to you in the OPD or in the ward, has come to the OPD. This is the basic purpose. What is the symptom of a meningitis? So meningitis symptom, fever will be there. And there will be neurological symptom because brain and spine, this central nervous system is affected. So neurological symptom will be there. Headache, commonest, because it will cause headache. It can cause neck pain also. And alteration of sense. This patient will not look like normal. He will have some sort of drowsiness. Or it can be semi-conscious and an advanced case. Patient may be unconscious also. Patient might come with convulsion also. And if you examine, neck rigidity will be a positive finding, definitely. A cardiac sign you will see, and neurological deficiency will be some kind of neurological problem will be there. So we'll come and then basically CSF finding will be shown. And what is your diagnosis? What is cardiac side? I can demonstrate it, but it is beyond. So I just wrote it. You need not write this thing. You write this one you write. That structure you remember, CSF circulation, the last point, AV valve, in the subarachnoid space. Just open that part. In the subarachnoid space, CSF comes in contact with the perivascular spaces, from where cells and protein leak during inflammation. Basically, mechanism of leaking of cells and protein during inflammation. This is the mechanism of leaking of, on the headline you write down, mechanism of leaking of cells and protein during inflammation. So this is the actual relevant point, most important point, and you must remember. And if there is obstruction to the flow of CSF, as I told you, if it is in the tumor or other neurological diseases, albumin is the predominant protein because it is of low molecular weight. Globulin are slightly higher molecular weight. So they can be high also. Gamma globulin can also be high if there is an immunological injury, and if there is a marked increase in probability of fibrillation. It is again a high molecular weight protein, 340 kilodalton. In contrast, albumin is 67,000 kilodalton. So when there is a very increased permeability, and this does happen in tubercular meningitis, because fibrillation is also present, and in a short while you will know. You write down here this part. During our time, we used to collect CSF in 6-7, total 6-7. So, routine parameter, what you used to do, biochemical. I will teach you today, just by doing this biochemical test, you will be able to diagnose. And if you see it psychological also, you can be able to diagnose. If you combine the two, it will be very easy to diagnose this case. And bacteriological investigation is done to see which antibiotic will be most appropriate for that particular infection. So we send the sample for bacteriological infection, what kind of bacteria is there or what kind of infective agent is there. So they do a culture, they do a stain, and then they do a report also, along with sensitivity to that particular bacteria. So biochemical evaluation, what is done? It's a priority sample. Remember, when you are drawing any CSF from anywhere, you please inform the laboratory in charge that I am sending a CSF sample. This CSF sample is processed on priority in the laboratory because the disease needs to be managed on an emergency basis, in contrast to routine test. So the moment we used to get a CSF sample, we used to put that CSF sample, and if required repeat testing, and immediately convert the report over telephone also. Then the report would have been sent in time. So CSF is a priority sample. Inform the laboratory. That's one important point. I have missed it. Write down as CSF. CSF is an infectious material. CSF is an infectious material. So you must handle also very carefully. You must not get infected. And you are drawing almost 6 ml of blood out of 125 ml of blood CSF. So there will be a post lumbar puncture headache, because some volume has been reduction is there. So usually patient is allowed to lie for 6 to 8 hours. Before that, he is not allowed to move because there will be headache. In upright position, there will be again lowering of blood pressure, on top of which this will be managed because CSF continuous flow is there. So first and foremost, there is an injury. Secondly, because this part I have forgotten. So post lumbar puncture headache is another important point. On priority glucose estimation, what you have done in the CSF, that same mechanism is given for, method is applied for all the body fluids per deciliter. The standard curve. Beyond that, we used to need to dilute the sample, and then you need to see what is the reading. This is a parallel method, just like blood glucose. Write down Pandis test. So for immunological test, we will be requiring one important test, that is Pandis test. It is for globulin. This is very rarely done. So those who will be, answering well, they might be asked, what is the test? All these things are for albumin. What is the test for globulin? This Pandis test. And here the degree of opalescence is found, just like your heat test acid or sulfuric acid test. Now, marked opalescence is found in multiple sclerosis. Multiple sclerosis can be diagnosed by MRI. But again, to have a real confirmation, you may be required to do a Pandis test also if you draw the CSF. Otherwise, only for diagnosing this case, the CSF is not done. Nowadays, that it is of historical significance. In those days, it was not known. Now, note down here. Normal appearance of CSF, it is just like a clear water. So, clear, transparent and colorless. protein CSF concentration is 15 to 45 as I have shown in the lumbar region. From lumbar region we puncture, so the CSF protein is 15 to 45 milligram, and cell count is less than 5 and is mainly lymphocyte. Now in appearance in diseases, so we will do only when there is a disease of meningitis. So from the appearance itself you will be able to diagnose. You will be puncturing, your patient is yours, you have examined, you have provisional diagnosis. Now you are doing the LP. So if it is a clear or slightly turbid, it will be viral. You are having viral infection, some watering from the nose. You collect it in a clear test tube to observe the color. It is not exactly just like water, slight turbid. So that will be the appearance of viral meningitis. It is a whitish or turbid if you suffer from infection pus formation. You take a little bit of water, put a slight amount of salt and drain the pus into that water and shake it. You will see a color of slightly white, that is the color of basically bacterial meningitis. You will not be able to get the CSF sample, so you can artificially create, or whosoever in your family is suffering from some kind of pus, don't get an opportunity to collect a little bit of pus. And in the water, if you give, there might be rupture, so you add a little bit salt, so that in a normal saline, the cells will not be damaged. So you will see be able to see the this pus color also. That will be that is whitish, but that will be the actual color of bacterial meningitis. And if you suffer from this viral fever, suppose today it has happened, tomorrow the nasal secretion will be a little bit thicker, and that is the appearance for tubercular meningitis. So slightly turbid. And as I told you, if the infection is severe, then you get a cobweb coagula. Now cobweb coagula means it is characteristic, it is because of fibrinogen and it is tubercular. Always tubercular. Cobweb coagula means it is tubercular. But cobweb coagula takes about 12 hours to form. So the CSF has to be kept on standing. In our days, we had to do that exercise. We had to collect one more sample. We had to keep in the ward. So redness, if there is a, it is called hemorrhage. So during needle puncture, accidentally you might puncture this blood vessel. It is possible. So blood will come. So initially the blood will come, but later part it will not come if you have inserted into the subarachnoid space. That I will show it to you. And xanthochromia is the yellowish discoloration. It is characteristic feature of subarachnoid hemorrhage. Now, if you make a puncture like this, accidentally you have picked it. So in this part you will get a red colored sample. Now this red colored sample will fade because this was accidentally have picked the needle while you are inserting blindly. And this is a clear fluid. If you send it to the laboratory, you will get a different report. You need to send this report here. So be very careful. Now, just to get this thing, you have collected already 8 ml of blood, 8 ml of CSF. On top of which again 2 samples will be 2 ml of samples will be required. So nowadays, because central laboratory facility is there, so CSF is collected into one container, and it is sent to the CSF central laboratory, from where they do the biochemistry test, then do the cytology test, also bacteriological test. So there may not be requirement of sending it in 3 test tubes, but we had 3 different departments in our hospital, so we had to send in 3 tubes. Now, this is the actual color of the CSF. Now, if the tap is hemorrhagic, that means you will get a CSF like this. Now, if you allow it to stand, the RBC will settle down and you will get a fluid here. This is xanthochromia, means bilirubin is present here. Bilirubin. This is characteristic of subarachnoid hemorrhage. And this is a normal color. Xanthochromia, subarachnoid hemorrhage are the characteristic feature. Why? Why from the bilirubin comes? Because RBC lysis occurs in the CSF. There is heme. Again, that same mechanism of bilirubin formation. So conversion to bilirubin. So you have to wait at least for 12 hours after the hemorrhage. So don't jump to do an tap if you suspected hemorrhage. Normally it is not done nowadays. So this is normal, this is abnormal. If the amount of subarachnoid hemorrhage is high, you will get a high concentration of bilirubin, that is deep color. Another point, rarely you will find, I got only one case in my life, that is Guillain-Barré syndrome during my internship. So normally, if there is an inflammation, there is elevated CSF protein and there will be proportional rise in the cell type. Cell also, because leaking is there, cell is also leaking and protein is also leaking. But in this case, particular case, in the acute phase, there is elevation of CSF protein without an elevation of the white blood cell. So normally there is an association between the cell count and the protein concentration. But this will not be associated here, there will be dissociation. That's why it is called albuminocytological dissociation. And that is correct characteristics of Guillain-Barré syndrome. Now viral meningitis, you see the normal color here. And you look at the color. So from the appearance you will be able to diagnose while you are tapping. Professional language পড়েই ফেলবে তুমি দেখি। So finding কি পাবো ভাইরাল meningitis দেখো ভালো করে তাকাও এই দিকটাতে অ্যাপিয়ারেন্সটা কি হবে কালার বা কালারলেস হতে পারে বা স্লাইটলি টার্বিড হতে পারে তার বেশি কিছু হবে না। প্রোটিনটা কিন্তু নরমাল থাকবে বা স্লাইটলি ইনক্রিজ হবে। নরমাল কখন থাকবে if the patient presents early, if the patient presents late, then you will get a slight increase, and if the patient is present too late, then there will be severe inflammation and the protein concentration will also be high. The glucose is usually normal because virus cannot really consume that much amount of glucose, unlike bacteria. Cell type, cell count almost around 225 to 500, normally it is less than 5. Of course, it can be more than this if the degree of infection is severe. Cell type is mostly lymphocyte. All viral infections, natural viral infections, you will get a lymphocyte count, not lymphocyte neutrophil count. But when you get a neutrophil count, that means it is a bacterial infection, even in normal cases. So coagulation means coagulation will be nil. Bacterial meningitis will always be turbid, just like pus. As I was explaining, that you collect a sample of pus and then you dissolve it. You will get a color like this. That you artificially see it in your house. It can be mixed with the blood also if the infection is severe. So once you get a turbid sample while tapping, you are well confirmed that this is a case of bacterial meningitis. There is no need to ask for anybody, any senior, sir, এটা কি bacterial meningitis, sir, এটা কি viral meningitis? না, কিছু কাউকে জিজ্ঞেস করতে হবে না। Take a photograph and keep it with you. At that point of time, you have taken a photograph. Now you are having a mobile photograph. So this is itself will be a diagnosis in the case. So finally, the laboratory report টা কিভাবে দেবে? Color appearance কি হবে? Operation হবে বা turbid হবে, whitish হবে, protein concentration কিন্তু বেড়ে যাবে। It is more than 45. Glucose concentration decrease করে যাবে কারণ কি ব্যাকটেরিয়া গ্লুকোজ খেয়ে নেবে, they will consume. And I got one sample where the concentration was 0. Now, no laboratory wants to give a 0 report. If you get a sample fully turbid, please go to the laboratory with a sample of distilled water and ask the laboratory show me the result of CSF from the machine automizer. They will try to hesitate because 0 report nobody wants to give. They will give either 5, 10, something like that. But you must be sure that sample cannot have a 5 or 10, it will be absolutely 0. So ask the sample, I will measure this sample distilled water, what is the glucose concentration here? And if it gives 5, that means the calibration of the machine is at fault. So these are the tricks I am telling you. I have made it open. Anybody can come and see this automizer. I have given an instruction during our time. So cell type will be predominantly lymphocyte, polymorphonuclear neutrophil. It's a characteristic feature of any bacterial infection, you will get a polymorphonuclear response. Anywhere in the body. If it is a viral infection, it is a lymphocyte. Coagulation may clot. One important point I am telling you, the CSF concentration, as I told you, it is almost 50% to 60%. Now, if it is less than 0.4, CSF glucose versus serum glucose versus CSF glucose, or plasma glucose versus serum glucose, less than 4, it is a diagnostic point of bacterial meningitis. Tubercular meningitis. If you allow it to stand overnight, you will find a cloud-like thing, just like this. This type of clot will be formed. So, if you suspect, at least for your own interest, to see this thing, draw extra tubable of blood and keep it in the ward itself, and observe on the next morning whether coagulation has formed or not. Tubercular meningitis, you will get it. I got a case with a 5,000 report of protein, and immediately rushed to the ward and told the clinician that this patient is having a tubercular meningitis. How did you come to know about tubercular meningitis? And protein is so high, I have never seen in my lifetime 5,000 total protein. So yes, the patient was having a long history of fever, and we could not diagnose properly. Now this case has been now diagnosed. Anti-tubercular drug was started, and the patient was discharged from the hospital within a week. It improved like anything.